All right, so let me introduce our guest speaker. And our guest speaker, tonight is going to be speaking about what you need to know pre and post being 65 years old, okay, with Medicare, and that's going to be a great topic. So Sara Finkelstein, she is a registered financial consultant and has been working in the financial insurance industry for 28 years. So I guess she does know quite a bit, okay? And she's got a website, I think she said, and her website is called yourmedicarelady.com. So I'm sure this will come up again, but we will discuss all these different things. So anyway, we are supported tonight by Sandoz and Sanofi. We want to thank them virtually with a round of applause. Everybody at home, you can clap your hands. I can't hear what you're doing anyway, so you can do it. All right, and let's get started. So Sara's going to speak for about 30 minutes. Then we will come back. I will come back online, and we will take your questions. So take it away, Sara. Thank you for being here.
Thank you so much, Stuart, for the opportunity, and thank you for that introduction. I do give these programs, these educational programs, live in person, locally in my community. And a lot of times people that are brand new to Medicare tell me that they are confused and don't feel alone, because a lot of people do feel that way. Next slide, please. Just a little bit about me so you know who I am and why you should maybe listen to what I have to say. So I grew up in New York. I moved down to Florida in 1990. I live in Delray Beach, and I am a Medicare planning specialist. I am also a registered financial consultant, a registered Social Security analyst, and I also do an educational podcast. It is called the Sara Finkelstein Show, where the next 10 minutes can change your life. Next slide, please. I am also a member of a nonprofit, the Association of Financial Consultants, which is an organization that does educational programs around the country on Medicare, Social Security planning, and retirement planning topics. And this is my give back. I like to educate people so that they are in a position to make a wise decision. This is a picture of myself and my husband Paul taken on a cruise. We just love cruising. I thought we looked really cute there, so I wanted to show you who my other half is. And lastly, this is Lucky. Lucky is a Shih Tzu Havanese. He is 11 years old, and I call him my Chief Marketing Officer. He works for his food, and he's an adorable little guy. So let's talk about the nitty-gritty. What is Medicare? Well, Medicare is the federal health insurance program for people that are 65 and older, baby boomers, those people born between 1946 and 1964. Would you believe that there are between 10,000 to 11,000 people turning 65 each and every day? It's a very, very large population. As you can see on this slide, I am the author of 2 books. My first book is called Wisdom for Women. By the way, gentlemen, the information there applies to you too. My second book I wrote as a booklet, as a guidebook for people that are brand new to Medicare or just need to understand Medicare a little bit better. Both of my books are written in a very easy to understand, very simple format, and they're both available in the ebook version. So if anybody here wants the ebook, I'm more than happy to email it out. Next slide. So let's talk a little bit of the history about Medicare. Medicare was written into law in 1965 under President Lyndon Johnson. He made Medicare available for people that are 65 and older. Next slide, please. And the first change to Medicare occurred under President Richard Nixon. What he did to Medicare was he made it available to people that are younger than 65, who may have certain disabilities or end-stage renal disease. So believe it or not, there are plenty of people that are younger than 65 who are on Medicare, such as Medicare disability. We're going to be talking about that soon. So for those of you who know, there are 4 parts to Medicare, and I stress the word parts, A, B, C, and D. Those are parts of Medicare, not to be confused with when we're going to be talking later about Medicare plans. So Part A is the hospital portion of Medicare. It covers you when you are admitted into the hospital, but it doesn't just cover hospitalization. It also covers skilled nursing facility, hospice care, and some home health care. Medicare Part B is your doctor visits, your outpatient procedures, your lab work, your diagnostic tests, helps you with preventive services. And by the way, most people do not pay a premium for Part A because we pay into it during our working years. So in order to qualify for Medicare, one has to have worked at least 40 quarters, which is the same as working at least 10 years. Then there is Medicare Part D, and I say easy to remember, D for drugs. That's your prescription plan to help you pay for your medications. So Part A covers, there's a few clicks on this particular slide, inpatient hospital room and board, skilled nursing facility, which is not long-term care, hospice care, and respite care services. And I think blood work is coming up, blood. Some home health care, blood, as in blood transfusions. Then we have Medicare Part B, which covers a lot of things. Your doctor visits, your outpatient procedures, your welcome to Medicare visit, preventive services like the flu shot, and the ambulance. There's more. Cancer screenings and chemotherapy, diabetic screenings and supplies, your durable medical equipment, which are walkers, canes, oxygen, limited chiropractic, vision, and hearing. And of course, occupational therapy, physical therapy, and lab work. So for those people that are close to turning 65 maybe, and you're getting tons of literature, you're not unusual. The insurance companies want your business, and they know it's public information when people are turning 65. So what I find most people do is they will collect all this literature that they're getting in the mail, and they end up with this pile of confusion. My suggestion for you is to work with an independent agent who can educate you and simplify things so you don't have to go through this big stack of literature. So here are the numbers. This is for this year, 2025. When you have original Medicare, which is different than a Medicare Advantage plan, and I'm going to be explaining that shortly. When you are admitted to the hospital, there is a deductible, which is $1,676, as you can see on the screen. There's also daily copays for long-term hospital stays. Now, we know nowadays hospitals don't like to keep you very long. They typically like to send you home even before you're ready to go home. But there are still situations where people can be in the hospital for a long period of time. So these numbers, as you could see, are astronomical. Under Part A, hospice care is also covered, and they define that with as 6 months or less to live. Under Part A, also skilled nursing care. as long as one has stayed a minimum of 3 nights in a hospital and they need to go into skilled nursing, the first 20 days are covered in full by Medicare. But then after that, there is a daily copay from days 21 to 100. It's almost $210 per day. So these numbers can add up to thousands and thousands of dollars. And blood is also covered under Part A. Then Part B, which we have a lot of things coming up here. So there is a monthly premium that everybody pays for Medicare Part B. This year, 2025, it is $185 for most people. Some people pay more than that based on their income level. There's also an annual deductible, which is $257. And then there is coinsurance. So Medicare will pay 80%, and the insured will pay 20% of the approved charges. This is what I was referencing before. Most people pay $185 a month for their Medicare Part B premium, but some people pay more based on their income, and that is called income-related monthly adjustment amount, and that changes every year. So let's talk about the basics of original Medicare. As we talked about, Part A and Part B. And even though it says that the drug plan, Part D, is optional, if you don't take it when you become eligible, you will eventually get hit with a late enrollment penalty, which will stay with you forever. So people who want to have the benefits of original Medicare will end up purchasing a Medicare supplement plan, also known as a Medigap policy. Why do they do that? Because they want to avoid all of those costs that we just discussed in the previous slides. And also what I want to stress about original Medicare is that it allows you to go to any Medicare provider across the nation. Any doctor, any specialist, any hospital, God forbid, any cancer treatment hospital, you have the full control and flexibility to get your health care where you want to do so. So let's talk about the gaps in original Medicare. As we saw, there are deductibles, copays, and coinsurance under Part A and Part B. Medicare will pay 80% of their approved charges, and then the insured will pay the 20%. But here's the thing. Doctors who accept original Medicare are allowed by law to add on excess charges, which is an extra 15% on top of what Medicare approves. So in some cases, it could actually be 35% that the insured has to pay. So now these are the plans. Remember, we just talked about the parts. We talked about Part A, B, C, and D. Now we're going to talk about Medicare supplement plans, also known as Medigap. And you see all these different letters. Plan G is the most popular plan because it is the most comprehensive. So when somebody signs up for a Plan G, the only thing that they will pay in addition to their monthly premium is the annual deductible of $257. Next slide, please. This is beautiful. All Medicare supplement plans are guaranteed renewable. What does that mean? That means that as long as you pay your premiums on time, you can never be canceled. And again, you have the freedom and flexibility to choose any doctor, any hospital, any specialist, anywhere across the nation. There are no networks and there are no referrals. It's beautiful. You're in the driver's seat. Next slide, please. Now, of course, there are laws and all companies have to follow the laws. The cost of the supplement plans vary. So, for example, because they are standardized, a Plan G is a Plan G regardless of which company you buy it from. But the premiums are different based on the carrier that you decide to purchase from. So the costs vary by the company, where you live in this country, the plan that you select, because you don't have to necessarily go with the most comprehensive Plan G. There are other letter plans, and their ratings and stability. So I just wanted to show you an example. And of course, premiums vary across the country, but this is Plan G for somebody who is on Medicare disability. As long as one is receiving Social Security disability after 2 years, you qualify for Medicare disability. And for example, as you can see here, this is in my local area in Delray Beach, Florida. A person age 65 would pay $271 per month for Plan G. But if they are on Medicare disability, younger than 65, they will pay over $1,000 for the same coverage. And all premiums are based on zip codes and, of course, age. So one can, whoever is on a Medicare disability can go on a Medicare Advantage plan, which many of them do not have a monthly premium. So let's talk about that. Medicare Part C is known as a Medicare Advantage plan. When you sign into that, that is a network-based plan. You have to use the providers that are in the network. It is also a calendar year plan. The plan can change from year to year. So you have to make sure that your doctors are still in the network. And by the way, doctors and providers can always change when you're a member of a Medicare Advantage plan anytime throughout the year. So even though there's no monthly premium for many Medicare Advantage plans, there is something called the maximum out of pocket, which protects your financial exposure, and it can be as high as $10,000. Now, the Medicare Advantage plan replaces original Medicare. And although, as you can see, it does have to cover at least what Medicare covers, but these are managed care plans, and sometimes people get denied on treatments and procedures. Next slide, please. There's more to this. So Medicare Advantage plan, as we said, must cover at least as much as Medicare Part A and Part B covers. A lot of the Medicare Advantage plans do include prescription drugs, so it becomes your go-to plan for everything healthcare. And when you get to that point, you have to decide with either going with original Medicare and a supplement plan or a Medicare Advantage plan. They're very different animals. Next slide. Then there is Medicare Part D, the drug plan. If you have a standalone drug plan because you have original Medicare and a Medicare supplement plan, you do need a standalone Part D drug plan, which has a monthly premium. They have their own formularies, meaning the prescriptions that they cover. There's also an annual deductible and copays for your medications, depending upon the tier level of drugs that you are taking. The good news is that this year, starting this year, there is a cap on what a Medicare beneficiary will pay for their medications. It's capped at $2,000 for the year. So that's good news. And also, how many ways are there to get your drug plan? You can get it in a standalone drug plan or as part of your Medicare Advantage plan. Next slide. So let's keep in mind that Medicare pays for things that are medically necessary. It will not pay for cosmetic surgery. So it has to be medically necessary. So if Medicare does not pay for something, your Medicare supplement plan will not pay for it either. Remember, it supplements where Medicare leaves off. So what is excluded under original Medicare? Long-term care, most dental care, hearing aids and fitting those hearing aids, eyeglasses, private duty nursing, concierge care. A lot of doctors are going concierge, massage, cosmetic surgery, as we said, and dentures. Those are excluded from original Medicare. So how do you apply for Medicare? Well, you can go to your local Social Security office to apply. You can also apply for Medicare online. But if you're already receiving Social Security benefits, you will get your Medicare red, white, and blue ID card about 3 months before you turn 65. Next slide. So how many different ways are there to get your Medicare plan? Well, you can go with original Medicare, Part A and Part B, with a supplement plan and a drug plan. The second way is original Medicare A and B, supplement plan, and no drug plan, which I would not recommend that. Or the third way is with going with a Medicare Advantage plan. Next slide. So have you heard, what is the initial enrollment window? That is a 7-month window within you turning 65. So it starts 3 months before your birthday month, the month of your birthday, and then 3 months after. That's when you can apply for Medicare Part A and Part B. If you don't do it around then you have to wait until the first quarter of the following year to apply. Next slide. So as a registered financial consultant, I help individuals with things beyond Medicare, such as retirement planning and long-term care plans. So many people don't think about long-term care and the other pieces of the puzzle that they need to get a solution for. Next slide, please. So there are healthcare costs in retirement that most Americans are not aware of, and this goes beyond what the costs are for Medicare. Next slide. So here's some studies. This was about 5 years ago. A 65-year-old couple in good health will need almost $400,000 to pay for healthcare costs for the rest of their lives. Next slide. Here's another study, and if you go to Google, you'll find a ton of different studies and what they predict. But here's another one that says a couple retiring will need almost $300,000 to pay for healthcare costs in their retirement. So these are big numbers, whether it's the smaller or the bigger, they are still huge numbers that require adequate planning so that you don't get hit with a catastrophe. Next slide. So there is a growing epidemic in our country. 70 million people are turning 65, and 70% of them will need long-term care. About that. That's 2 out of 3 people that will need long-term care. And most Americans, nobody's talking to them about this. This is the other side of planning for Medicare. This is a big piece of retirement planning. Next slide. Let's take a look at some average costs. This is from 2023. And of course, it depends where in the country. That does differ. Also depends on where you get your health care. So a home health aide would cost over $5,700 a month, but that would not be 24/7 care. Assisted living starts at $5,250 roughly. Some places are more, some are less, depending when, where, and what, depending upon whether you get a studio apartment, a 1-bedroom, a 2-bedroom. And nursing home is the most expensive. It could be as high as $14,000 a month. Next slide. So true or false? I'm going to read these out to you and then I'll tell you what the answer is. 46% of those 85 and older will develop Alzheimer's or dementia. This is true. 1 out of 7 of today's 65-year-olds will need long-term care for 5+ years. They say that the average long-term care claim for a male is 3 years and for a female, 4.2 years. But 1 out of 7 will need it for more than 5 years, and this is true. 40% of Americans have purchased long-term care protection. Not true. Consumer Reports says it's 22% of the population, which still means that a great majority of Americans are not prepared. Medicaid funds about 81% of long-term care. That is true. And 33% of Americans think that Medicare pays for long-term care. Unfortunately, it doesn't. This is not true. So if you've been listening, you know the answer is no. It does not pay for long-term care. And there is a retirement income gap when one retires. If you have the income that you need, you'll be able to weather the storms along the way. Next slide. So I think I'm right on time for questions, or maybe just a little bit early.
Thank you very much, everybody, for being here. And it was mentioned about in the past, not from you, but from others, about hospice care and Medicare. And they wanted to know, I think you mentioned it during your talk, how much of Medicare pays for hospice care. Can you mention this again, please?
How much they pay?
Yes.
Was that the question? Yes, they pay
Yes.
all of it.
All of it. Is there a time frame that's allowed for?
It depends on the situation. Usually, if a person is not getting better, they may not continue covering it.
Okay, that's true too. You're right about that. I mean, it doesn't make sense, right? But what about people that go on hospice and then decide that they want to have some kind of treatment done that hospice won't allow, so they have to come off of hospice, and then they have to go back on hospice again, maybe later on when they're starting to feel like things are starting to progress again. So can you tell us anything about that?
I haven't run across that. That is an excellent question.
You didn't know my mother. You didn't know my mother.
I need to look into that.
Yeah. So for anybody that doesn't know, which is probably most of you, my mother passed away a month ago. I don't need apologies. I don't need sincerities or anything like that. All right. But my mother was the type that was on hospice. And then when she wanted something done that was what they call preventative care, she had to come off of hospice before going back on. So, but everything was picked up again. And I just didn't know how that's covered, you know, and is there, I mean, some people have said there's like a maximum of 6 months. How does Medicare say that, well, the person's only going to last 6 months or not last 6 months in order to cover you?
It's a good point. I guess that initially they have to estimate that it's going to be 6 months or less.
Okay. All right. Next, we have another question, and that was about what you said about the 15% overage that doctors are charging. Can you tell us a little bit more about that? Because you were very quick and people just didn't get it.
Sure. So that is called excess charges. And the rules are doctors who take original Medicare, not the Advantage plan, original Medicare, are allowed by law to add on an extra 15%. I will tell you, though, that the majority of doctors do not. Nationwide, it's about 3% of physicians, they actually do that. So if you have Plan G and your doctor does that, you don't have to worry about it. But if you have a different letter plan, it may not cover the excess charges. So a good way to find out from your physician is you ask them, do you accept Medicare assignment? And if they say yes, then they're not adding those excess charges.
Okay, thank you. I know you mentioned Plan G often, but did you tell people that that's part of supplement plan?
Yes, that is a Medicare supplement plan, also known as a Medigap policy, which works hand in hand with original Medicare that allows you to go to any Medicare provider across the nation.
Right. So the differences of Medicare supplement plan or a Medicare Advantage plan. Medicare Advantage, I think you mentioned that it is a managed care plan and things do change all the time. But can you give a little bit more of a talk, please, on the differences between the two?
Sure. So for those of you who watch TV, and maybe you've seen the commercials on TV, especially during the annual enrollment period, which happens from October 15 to December 7, that's when you see a lot of these commercials that tell you about this is free and that is free, and it includes a free gym, and it includes dental, and it includes eyeglasses. those are Medicare Advantage plans. And sometimes the commercials can be a little bit misleading, because I've seen some of these commercials where they'll give you all of the benefits and make it seem like all of those extra benefits are in one plan. And that's not the case. So buyer beware, and make sure that you know the differences. When you sign up for a Medicare Advantage plan, you're locked into it for the year, except for when you're brand new to Medicare. If you're brand new to Medicare, let's say the example of turning 65 and becoming Medicare eligible. At that point, you could sign up for a Medicare supplement plan without having to answer any health questions. They will accept you no matter what. But let's say that you start with a Medicare Advantage plan because it looks attractive. It's a zero premium plan. You get these other benefits that original Medicare does not cover. So you go on the Medicare Advantage plan. Let's say it works out for you. You stay on it for 5 or 10 years. And then you're older. You're not as healthy as you were at 65. And now you want to go back to original Medicare and go to any doctor that you wish. At that point, you do have to answer the health questions that are part of that application, which means that you may or may not be able to get accepted for a Medicare supplement plan.
Okay.
Does that make sense?
Okay. Yes, it does. All right. There are people that have asked, older people, older than myself, okay, about the differences of Plan F and Plan G. Can you please just explain to people what the difference is with that and why Plan F doesn't exist anymore?
Sure. So the only difference with Plan F and Plan G is that Plan F does pay the Medicare Part B annual deductible, which is currently $257, pays it on your behalf. Plan G does not, and that is the only difference. And Plan F is no longer available for people that turn 65 as of 2020, and it all has to do with the government.
Right, exactly. So Plan G, to have Plan G and to get prescription coverage, you have to have Plan D. And
Part D.
Say that again?
Part
D. Part D, exactly. Part G, Plan G, Part D, whatever, you know what I'm talking about. All right. So to have Part D coverage, are there, for people to know, are there donut holes, so to speak? Do we have that problem with the Part D plans?
Actually, that has changed. So they've capped the copays to $2,000 for the year.
Right, and that's brand new, correct?
Yes, it's brand new for this year. So it's really good for people that have expensive medications. It's great. If you were paying $8,000 or $10,000 last year, now you will pay no more than $2,000. The flip side of that is for people that did not have expensive medications, many of them have seen their Part D premiums increase a lot.
Right, right. So for those of us with multiple sclerosis, which I think that most of the people online tonight do have MS, we all do know that the cost of the drugs are very, very high, but now you're going to max out at $2,000, so that's a great thing. Okay. By the way, I just published an article on our blog on the website about this max policy. So if you want to go into that, it was sent to me earlier today by somebody from a pharmaceutical company, so that way everybody can know about this max outpay now. So if you go to our website, you can check it out. Now, let me get to some of these questions that people are writing, all right, because now the door's opened and everybody's sending questions. One of them is, can you tell us more about the dental policy? How much is the cap on that?
The dental within a Medicare Advantage. Yeah, it depends on the plan. Each plan's different. Some plans might have a $1,000 cap on it. Some might have $3,000. It all depends on the particular plan. So every carrier may have more than one Medicare Advantage plan per zip code area, and it all depends.
Right.
So the Medicare Advantage plans are not standardized, whereas the Medicare supplement plans are. So they are different from each other.
Thank you. So speaking about the zip codes, does it go up because you're in an urban area, or does it go up because you're in a more rural area?
Typically in Florida, the premiums are higher than, say, the middle of the country. So I've had clients that moved out of Boca Raton, Florida. They went to Tennessee or North Carolina. Their premiums were about half of what we're paying here in Florida.
That must be because we have too many old people in South Florida.
But you'd think the opposite, right? So because
Yeah,
we
you
have a
would
lot
think.
more.
Right. All right. What can you tell us about, does Plan C replace A and B?
Medicare Part C does replace original Medicare. Even though you're still paying for Part B, it does replace it, yes. It's an
Okay.
alternative to original Medicare, and it does replace it. And every year between October 15 is when you would have an opportunity to shop around for a different Medicare Advantage plan. And for those who have original Medicare with a Part D drug plan, also during that time period is when you would shop around for a different Part D drug plan.
Right. Thank you. How do we know which MS medications are covered by Medicare and/or I'm going to add to that now of my own. How do we know which ones are covered by Advantage or Supplement?
Well, the supplement doesn't cover any prescriptions. It's just the Part D drug plan. So we would have to take a look and see. I do that a lot for my clients, is look up their medications to see, first of all, is it covered? And secondly, what is going to be their copay?
That's correct. But how do they get a list? How do people online or those that are going to be watching this later on get a list of which MS medications are covered by which plans? Do they have to call around to each one separately and find out?
It's an excellent question. How many different MS medications are there?
28.
Yeah, I don't know the answer to that.
I do know the answer to that because I lived this. All right. The answer is, everybody, you need to do your own homework. All right. You need to be able to get on with, if you get an agent, that's great. But how much time does that agent actually have to look up so many different plans or parts or whatever you want to call it of Part D and the different pharmaceutical, what do you call them? The specialty pharmacy people, as well as the different insurers that you have. So realistically, you need to do your own homework and find out from the different companies who will cover it, whether it be Humana or whether it be United or whether it be ARP, which is United, or so on and so on and so on. But you would have to call each one of them to find out if they cover your medication.
And another way to do that is you could also go to Medicare.gov, enter your zip code and your medications, and it'll spit out the different drug plans that cover those medications.
Okay, that's another way. All right, next, skipping away from Medicare for a second, a person wants to know, what will Medicaid pay for with regard to long-term care?
Medicaid, okay. So Medicaid will pay 100% of the cost for nursing home, but it will not pay 100% of the cost if somebody needs assisted living. I believe that it pays about maybe $1,600 a month if one qualifies for Medicaid for the levels of care in assisted living.
So if they're on Medicaid, though, don't they need to be, I'll just say it for lack of better words right now, specifically put into what's called the poorhouse for 5 years prior to going into the system?
Yeah, but also attorneys have their ways.
Right. So what I mean by that, everybody, is that many times if you own a home, you cannot necessarily use your Medicaid and just go into an assisted living place or memory care or even independent living. You have to be realistically broke from your home sale prior to attempting to go into a residence like that, and you have to be 5 years plus away from that money. So Think about that way in advance. Give all your money to your kids and let them take care of you.
The other thing too is not every assisted living facility accepts Medicaid.
That's true. That's true. All right. Next, the next person writes, if you change from your original Medigap plan, can you be denied or rated due to a chronic illness like MS?
If you switch to original Medicare, you said?
If you were in the original Medigap plan, can you be denied or rated differently due to having the chronic illness like MS when you first began?
So if one starts out with a Medicare supplement plan and then switches to a Medicare Advantage plan, right? And then wants to go back to a supplement plan?
I think what the person is saying that regardless if they start with whether it be Medigap or if they're on any other Medicare plan, if they want to switch from one company to another, are they going to be told no because they already have an existing condition?
Yes, that's what the health questions are all about. So if somebody can't answer no to certain health questions, they could be denied.
So in other words, what you're saying is that that there still exists a pre-existing condition, even though and you're talking about for Medicare versus pre-Medicare when they were on insurance, there were no more pre-existing conditions since Obamacare.
Well, it's a 6-month window. So whenever your Medicare Part B effective date is, you have 6 months within which you can get a Medicare supplement plan and bypass the health questions.
Okay, there you go for that. Hey, everybody, go ahead, you first.
I'm sorry. Yeah, okay. So when let's say somebody is turning 65 and they go on, let's say, either a Medicare Advantage plan or a Medicare supplement plan. As long as their Medicare Part A and Part B dates are the same, they have what's called a trial right period. So let's say somebody starts out with a Medicare Advantage plan, and then they want to switch back to original Medicare and get a Medicare supplement plan. They have a 12-month trial right period within which they can do that without having to answer any health questions.
Okay, thank you for that. So for anybody that's new to this drama series that I have, if you hear me being a little curt, is because I have questions to ask that you all don't have to ask, and I have to ask those so you can learn more about it, okay? All right, next, are there any drugs that are not allowed, such as newer drugs? Do they get excluded from Medicare?
So there are drugs that, let me say it this way, Medicare does not cover every single drug on the market. And depending upon the drug, we'd have to take a look at it on a case-by-case basis to find out.
That's great. Thank you for that answer. How does Medicare mix with VA care?
So I have some clients that have a VA and they use the VA, but they also go on a Medicare Advantage plan because it gives them more options, more doctors that they could see. There are specific Medicare Advantage plans for those people that does not include prescriptions because the VA people typically get their medications from the VA.
Okay, thank you. Next person asks, what is a generic cost for Advantage plans in Florida? An average
Zero
cost.
premium. Zero premium. So there's no premium, there are just co-pays. Whenever you use your plan, you go to your doctor, you use the ambulance, you go to the ER, there is a copay attached. The good news is that every plan has a maximum out of pocket to protect your financial exposure.
Okay, that's good. All right, next, so the same person writes, so Plan G is an expensive supplement plan at $271 a month. What are some of the more affordable supplement plans?
The more affordable plans are like, say, Plan N, which has, because it has a lower premium, there's more cost sharing on your end. So for example, on Plan N, You have a $20 copay when you go to see your doctor. There's a $50 copay for the emergency room, which would be waived if you're admitted from that visit. So I don't think those are really a big deal. But if you do have a doctor that adds on the excess charges, Plan N does not cover it, so you'd have to pay for that out of your own pocket.
Okay, thank you for that. Next, with regard to...
May I ask a question?
Sure.
If you happen to know if anybody on this program is from New York, would you happen to know?
How old it is? No. What's the question?
Okay, so New York is a slightly different state in that people can switch their Medicare supplement plan at any time without having to answer health questions. That's very, very unique.
That's because it's a good state. I'm from there.
Me too.
Right.
I'm from there also.
Great. All right. Next question. I'm going to combine with a lot of different people asking similar questions, and that is with regard to infusion medications. These are not covered under Plan D because they're done at a doctor's office. So can you tell us about that?
Sure. So if it's done at the doctor's office, it falls under Medicare Part B as in boy, which your supplement plan would pay for.
Okay, great. Thank you for that. Next one. A person writes, my spouse is 67 and on his employer's plan, but signed up for Medicare, but does not have supplement plan. When he retires this year and goes off his employer's plan, does he have to answer a supplement retirement plan questionnaire?
So if he's already got Part A and Part B in place, then yes, he would have to answer the health questions.
Okay. What are some of those health questions?
It depends on the carrier, but it could be, would you like me to pull one?
If you'd like.
I don't have them memorized, so let's see here. Okay.
While you're doing that, can you answer another question, or do you
Yes.
or have you found it?
I got it.
Okay. Go for it.
Do you want to ask the other question?
No, you can answer yours first.
Okay. Are you currently confined to a wheelchair or any motorized mobility device? Are you currently hospitalized, confined to a bed in a nursing home or assisted living facility? Have you been medically diagnosed with, treated by a physician for, or had surgery for any of the following? Chronic kidney disease.
Okay. All right. We've got a gist of what it is. All right. So I don't want you to have to ask all the questions, but where can somebody find those questions in advance?
You could ask me.
Okay. All right. Maybe you should write an article and we'll blog it, and this way people can know about it. Okay.
Okay. Good
All right.
idea.
Great. Okay. Cool. All right. Great. The next one writes, she writes that regarding Plan F, she writes, it's not true that Plan F does not exist anymore. I just signed up. In order to be eligible for F, you must have been eligible for Medicare prior to January 1st of 2020.
Yes, that is correct.
Okay, way to go. All right.
However, Plan G might be sufficiently lower in premium to be more beneficial financially.
Okay.
I have been switching a lot of my Plan F clients to Plan G because of the savings, even though they have to pay the Part B deductible.
All right, next one person is going backwards again and needing to know, didn't hear the answer about infusion drugs. Can you say that again, please?
Sure. So any medications that are administered in a doctor's office fall under Medicare Part B, as in boy, which the Medicare supplement plan pays for.
Okay, great. Thank you for that. Next, person writes, I know Medicare doesn't cover long-term care. So do you know of any options for LTC, long-term care, for people with pre-existing conditions like MS?
I believe there's some situations where it would be covered, but it depends on the particulars of the MS case. And if, let's say, it's not an option for a particular person, there are other ways to plan for long-term care.
So I'm going to add into that in a minute. I looked for long-term care after being diagnosed with MS, and it's almost impossible. And where it is possible, it costs so much that you just better hope that you don't need it, okay? Because it'll break you before you even get to that stage of possibly needing it. It's just ridiculous what they would do to us because we're already diagnosed with MS or any other condition for that matter. Okay, next person writes, speaking of Medicaid, how can families protect the surviving spouse so all the family assets don't get spent on one person?
I think that's more for an attorney who specializes in that area.
Okay, good answer. Kevin, we will have to wait until we get a Lisa on the phone again, okay? Great. All right, next, if an MS patient doesn't sign up for a Medigap plan at 65, then they'll never get it? Is that a question? If an MS patient doesn't sign up for a Medigap plan at 65, will they never be able to get it?
It depends why they didn't sign up. Were they on a group health insurance plan? Then
okay.
there might be different scenarios.
All right, thank you for that. Next one. We're running out of questions, all right? I'm going to do another one because I have to figure out what this first one's trying to write. Do any Advantage plans have health questions?
No, they have to accept everyone.
Okay, thank you. All right, next, do most of these supplement plans have certified MS neurologists?
I don't know. That would be something I could look up.
Yeah, I'm going to say that that most of your supplement plans, you have a choice to go to any doctor you want. You have to call that doctor's office though and find out if they accept that plan that you might be on. And I know this for a fact because my neurologist's office does not accept Blue Cross. Okay, for whatever reason, they just don't take Blue Cross. So you would think that you have the best insurance in the world, which could be Blue Cross. Okay, but this place does not take it. So realistically, I think you just have to find out if your doctor's office accepts what you have rather than the other way around.
And I'd like to just add to that. And what you're mentioning is rather unusual for a Medicare supplement plan to say they don't accept, because the way Medicare, original Medicare works is any doctor who accepts Medicare, it doesn't matter which carrier it is, they take all of them because they pay the same way. It's identical coverage. So it's very unique that Blue Cross does not.
Thank you. All right, so person writes, Stuart, you're 100% on what you said about long-term care. And yeah, I just got to go back on that. All right, next person writes, unfortunately, there are life insurance policies that offer long-term care, but we cannot qualify because we have MS. Yeah, I've heard of that also. What do you want to say anything about that, please?
As I said before, there are other ways to plan for it, which might be a different program for us to do.
Okay, thank you for that. Also, there are annuities that people have that some of the older annuities also had long-term care policies on there as well, but you can't change what was in the original policy, and now you have that issue because they don't want to accept what you've got. So, okay, next one.
By the way, if I may add, if let's say we're dealing with a married couple where one of them does not have MS, that individual could apply for any type of long-term care policy, and it's better to at least have one person covered than two of them in the household not covered.
That's great. That's a good answer. That's a really good one. All right. Next one. What supplement plan am I on? United Healthcare. I'll tell you that. I did a lot of research, everybody, but for the medication that I use, they again, they don't cover it. Well, they do cover it, but you really need to do your own homework on all these things. But I chose them because of the overall payouts that they have compared to some of the others. And I don't work for United Healthcare. That's my disclaimer. I get nothing from telling you that I'm telling you this. Okay. All right. Next, how can I purchase your books? A person wants to know.
My books are available on Amazon, and if you want to get the ebook version, as I said before, I'm more than happy to send it out.
Okay, great. Thank you for that. All right, I cannot ask any more questions. A lot of people are asking questions that are a little wording to do with something that was asked 10 minutes ago, and I have no way to ask that. So, so we're going to say that's a wrap, all right? And we're going to thank you first that you were online with us tonight. If anybody has any questions for Sara after we hang up from this, send an email to me, all right? I'll forward it to Sara. She can respond to you directly. I don't need to be on there. Oh, she's going to write out, she's going to tell you her email address, right?
Yeah, I can give you my email address, but I also wanted to clarify one more thing. So let's say that an individual is younger than 65 and they're on Medicare disability, and let's say they're on a Medicare Advantage plan because they can't afford those high premiums for Medicare disability. When they turn 65, now they have an opportunity to get a Medicare supplement plan and get the lower premium as any 65-year-old would. So I just wanted to clarify that. And my email address is Sara, S-A-R-A, at signatureadvisorygroup.com.
They're definitely not going to get that. I'll tell you what, everybody, if you have a question for Sara, send it to me. Hopefully I get to see it in the next 2 weeks because my emails are 2 weeks behind and a lot of people don't like that, but I can't help it. Send it to me. I will forward it to Sara. She could send it to you directly because I don't need to be in the middle of that, okay? All right. Again, thank you very much, Sara. Thank you for being here. And we're going to say goodnight to everybody. Have a good one. Ciao, ciao.
Bye-bye. Thank you.
Bye-bye.